Good morning, my distinguished professionals. I'm Geng Hui from Peking University First Hospital, and today I will show you our research, cardiovascular outcomes in initial and sustained orthostatic hypotension, a retrospective cohort study. I will introduce it from 4 parts: introduction, methods, results, and discussion. Orthostatic hypertension is a very important medical problem, especially in elderly patients. And studies have shown that the OS will increase the risk of developing the heart failure, coronary heart disease, atrial fibrillation, ischemic stroke, and falls. The classical OH, also named as sustained OH, is defined as a sustained reduction in systolic blood pressure by at least 20 mmHg and a reduction in diastolic blood pressure by 10 mmHg within 3 minutes of standing or hand upheld. Improvements in hemodynamic providing the continuous blood pressure measurements have helped us to uncover the subtypes as sustained and initial OH. Initial OH is defined as a transient blood pressure decreased by more than 40 mmHg and systolic and/or more than 20 mmHg diastolic blood pressure within 50 seconds of standing. Initial OH is used to be underreported due to its requirement for specialized equipment for measurement. Up to now, limited data are available regarding the prognostic importance of initial OH and its comparison between that and sustained OH. And therefore, our studies aim to investigate cardiovascular outcomes in initial and sustained OH. And it's a single-center retrospective cohort study conducted in our hospital. Patients aged more than 50 years old hospitalized in the geriatric cardiovascular department between January 2017 and April 2018. The including criteria included able to stand up active from the supine position and keep fit for 3 minutes, can cooperate well with the measurement by the CNAP monitor. The included criteria included the needed immediately treatment, had a cognitive disorder, thus were not able to provide informed consent, and had irregular heart rhythm. We used the CNAP monitor for continuously measurement, and we have the measurement of the systolic and diastolic and heart rate at the supine position within 3 minutes and 15 seconds and 3 minutes after directly active standing. According to the measurement, we grouped our patients to 3 groups. The initial OH is a transient patients who had a transient decrease in systolic blood pressure by more than 40 mmHg and/or diastolic blood pressure by more than 20 within 50 seconds of active standing. This blood pressure recovered between 50 seconds and 3 minutes of standing. And patients who were grouped into sustained OH were ones who had a sustained decrease in systolic blood pressure by more than 20 mmHg and/or diastolic blood pressure by more than 10 mmHg at 3 minutes after standing. And the resting patients who were not met any of the criteria above were grouped to the non-OH. Other participants were visited at intervals of 6 months up to January 2023. And we defined primary outcomes as the composite of major adverse cardiovascular events, MACE, and deaths from any cause. The secondary outcomes were defined as included MACE and death from any cause as two separated outcomes. And here we define the MACE as cardiovascular death, myocardial infarction, angina pectoris, heart failure, or atrial fibrillation. We used the SPAS for statistic analysis. In the flowchart of our study, we have 520 patients who met the criteria for inclusion and exclusion, and we examined the patient's demographic information and comorbidity disease and medication from their medical records. And all the participants have the orthostatic blood pressure measurement by CNAP monitor, and then grouping by the orthostatic blood pressure changes. In the end, we have 43 patients who have initial OH. 51 were grouped into sustained OH, and the resting 341 were grouped into the non-OH. We follow up to January 2023. In the end, we have 159 have the primary event, 142 had MACE, and 21 had all-cause death. Furtherly, we investigated the cardiovascular outcomes in initial and sustained OH. And then let's take a look at our result. Table 1 have showed the characteristics of patients in 3 groups. There are no significant differences between 3 groups in the sex, BMI, comorbidities with hypertension, coronary heart disease, and the lipidemia and medication, and the serum creatine. However, they show differences in the age and the comorbidities with diabetes, and the patients who have compared to patients in the non-OH and initial OH group, patients with sustained OH were older, and the patients, however, no difference was shown between the initial and the non-OH, and patients who have initial OH are less likely to have comorbid diabetes. And sustained OH group have higher supra-systolic blood pressure, and expected from the definition in non-OH group, the decrease of orthostatic systolic and diastolic blood pressure within 50 seconds were less than those in initial and sustained OH. The decrease of orthostatic systolic blood pressure within 50 seconds between initial and sustained OH show no significant difference, while the decrease of diastolic blood pressure in initial OH was larger than that in sustained OH. And sustained OH tends to have larger orthostatic systolic and diastolic blood pressure and declines at 3 minutes compared to the non-OH and initial OH. However, less orthostatic heart rate change at 3 minutes. And the KM analysis showed that the initial and sustained OH had significant higher rates than non-OH, with the rates was 54.9% for sustained OH, 51.2% for the initial OH, and 32% for the non-OH. However, no significant difference was shown between initial and sustained OH. And as for the MACE, the KM curve was presented here in the second picture and illustrates that the initial and sustained OH curve is significantly steeper than the non-OH curve, where also there were no difference between initial and sustained OH. However, in contrast, as for mortality, patients with sustained OH have a higher rate than the ones with initial OH and without OH, and the rate was 15.7% for sustained OH and 2.3% for initial OH and 3.5% for the non-OH. There was no difference shown between the initial and the non-OH. And besides, after conducting the Cox univariate analysis, meaningful factors were selected for further multivariate analysis. After the adjustment above, initial OH remained associated with primary outcomes and MACE with the HR 2.2 and 2.38, but not with the overall mortality. However, the association between sustained OH and primary outcomes MACE, as well as the overall mortality, remained significant with an adjustment hazard ratio of 1.77, 1.71, and 3.32. And in the Cox regression models, we also observed that the age, coronary heart disease, and serum creatinine are associated with primary outcomes. Similarity, we find the coronary heart disease and serum creatinine are associated with MACE. As for mortality, age and serum creatinine were found associated with mortality, where there was no significant association with other factors. Let's go to the discussion. Sustained OS patients tends to be older, and it may be the normal physiological decline in baroreceptor sensitivity, and also the age associated increased prevalence of autonomic neurodegenerative diseases as the diabetes, and also the patients with sustained OH have higher comorbidity of diabetes. In contrast, in initial OH show no difference from the non-OH and even have a lower rate of comorbidity of diabetes, as the initial OH is also fairly common in the youth population, and orthostatic blood pressure dysregulation in patients with diabetes may be also orthostatic hypertension. And in our study, no significant differences in antihypertensive medication between three groups were shown, as our study had a limited sample size and the low number of patients taking diuretics and alpha receptor blockers, for we have already avoided such medication in the geriatric patients who have cardiovascular disease. And also in our study, our results on sustained OH were consistent with the conclusion of multiple large prospective cohort study. As for the initial OH, previous studies on initial OH are focused on its association with syncope, especially in young adults. In contrast, our study on initial OH revealed its association with the cardiovascular risk in mid-age and elderly people. Its results suggest that for mid-age and elderly people with multiple comorbidities and polypharmacy, an immediate drop of blood pressure in less than 3 minutes to a certain extent is enough to increase the risk of adverse cardiovascular outcomes. And the initial OH didn't increase the all-cause mortality, in contrast to the sustained OH. However, up to now, the pathophysiology remains not tightly understood. Maybe prolonged hypoperfusion of the heart and brain may play a role in the mechanism. And our study also showed the coronary heart disease and CKD were positively associated with the cardiovascular outcomes. And the coronary heart disease is a crucial threat to the elderly and public death, and is closely related to myoinfarction, angiopectoris, heart failure, and atrial fibrillation and cardiac death. And besides, the study showed that the serum creatinine, a traditionally unreliable estimation of the renal function, was positive association with the primary outcomes and all-cause death. And numerous studies have shown that patients with CKD, coronary kidney disease, had exhibited an elevated cardiovascular risk. Maybe the CKD may cause a systemic chronic pro-inflammatory state, contributing to vascular and myocardial remodeling processes. And the advantage of our study is that we have investigated the cardiovascular outcomes in initial and sustained OH, and we have made comparison between different subtypes of OH. However, we have some limitations. We didn't evaluate neurological diseases like Parkinson's disease and dementia. And it's a single center retrospective cohort study with a limited sample size. And some confounding factors were not fully discussed and addressed. And that's a conclusion. OH, no matter initial or sustained OH, increased the cardiovascular risk in patients more than 50 years old. However, only sustained OH increased the risk of mortality, where initial OH didn't increase it. Therefore, sustained OH after 3 minutes of changing position may represent severity of OH, deserves more attention, and if necessary, appropriate clinical intervention. That's all. Thank you for your attention.